Good morning, everyone. I want to go over what we have for your Module 6 course objectives, as well as discuss some of the homework for this week. So let's go ahead and start with your course objectives. So for this week, the first one that we have is apply previous training knowledge to perform any tests required of the medical office at your externship site. So for this one, think about all of the CLIO waived things that we've done throughout your time at Rasmussen: strep testing, injections, pregnancy testing, mono testing. We learned how to do occult blood testing. We learned how to collect urines for urinalysis, both physical, chemical, and microscopic. Anything that we did while you were on Rasmussen's time with us are things that you should be able to do at your externship. The second objective is to determine the correct way to obtain a medical history from a patient for physician interpretation. And remember that this is different for everybody, but you need to find a way that works best for you, as well as gives you the ability to get all of the information from the patient and get it in a way that the physician can use it to their advantage. Hopefully at this point you all are rooming by yourselves. I know that some of you are done with externship, and that's okay. Obviously you guys had already reached that point. So those are the course objectives for this week. For your homework, the first thing I want to talk about is your Module 6 discussion board. And this week it's on the varieties of communication. So the quality of communication influences patient satisfaction, compliance with medications, and clinical outcomes. Patients who inaccurately understand their prognosis ultimately end up making decisions based on unrealistic results. So what you need to do is, so far in your externships, have you or your mentor encountered a communication gap with a patient? If so, we would like you to explain the situation and how it was handled. Now, I want to encourage you to remember that you do need to keep patient confidentiality and follow HIPAA. So you can't give any patient names, but you can explain the situation. If you have not come across this, please provide a situation where you think it could be a potential error could occur. Now remember that your initial post is going to be due Tuesday by midnight, and you need to have that be at least 200 words in length. You will need to reply to at least 2 classmates by Saturday at midnight. And your reply posts need to be very thorough, and they should be at least 100 words in length. Second assignment we do have is your Module 6 timesheet. So those of you still in externship, you know how this works. Please make sure that it is physically signed, and please make sure you are using the electronic version, so that way it is counting your hours for you. If you are finished with externship, you still need to turn in a live timesheet, but the timesheet should, in the area where you would normally have your preceptor or manager sign, you're going to type in finished externship and then the date, and then you can turn that in for full submission. All right, guys, that's all I have. If you have any questions, please reach out to me via email or via phone. Have a great week 6, everybody. Bye-bye.